I was in a Zoom call, and as you do in the meeting, you might absent-mindedly play with your hair or touch your face. I had my hand under my underarm, and I was literally feeling my underarm going, I need to shave. And then I started to feel the side of my breast, and it was just, I wasn't even paying attention to it. And then I realised there was a lump, and then froze and went, okay, what's that? And then as soon as I clicked leave to that meeting, I ran from my desk to my bedroom and threw my top off and just started feeling around and realised that it was, yep, it's there. So I booked a doctor's appointment for the next day, and then they sent me to get a mammogram and ultrasound, which I got 2 weeks later. There were some things that made it look okay, but there was some things that said it was suspicious, and I have to say that suspicious is probably one of the worst words to ever use when it comes to your health. I then went to a breast surgeon and had a biopsy done. 2 days later, I got a phone call, and he told me that I had a grade 3, which is a very aggressive type of triple negative breast cancer, and it was at a stage 1, so that's really great on my side. I'm very lucky that I saw it, and I'm very lucky I didn't hesitate, because that's the 2 main things that, I can't even, whew, it's like relief, but also, oh my God, I'm about to go into treatment. So my recommendation to anybody, it doesn't matter whether you're going through a pandemic, whether you think it's silly, the ailment that you have, or even if you're embarrassed, doctors actually don't care. They're there to help you. Even though I don't like the fact that I have cancer, I don't like the fact that I've got triple negative, I don't like the fact that, I can't really find out a lot of information to why this has happened to me, but at least I got it early, and at least I'm being treated for something. I can't stress it more to you, just don't hesitate.
Yeah, that's the message, isn't it? Don't hesitate. To tell us more, head, neck and endocrine surgeon Dr. Bruce Ashford. He joins us from Wollongong. It's good to have you with us. And just listening to that story, and you read about it and you see it all the time, isn't it? That timing is absolutely essential. What difference can it make if you get onto something early enough to your survival rate?
Well, I think you treat cancers as early as you possibly can, Stan. I mean, there was a study from the UK last year which said there'll be probably 3,600 avoidable deaths in 4 cancers over the next 5 years. That's not just death, that's avoidable deaths, because people have come too late to a diagnosis, or they've missed out on regular screening, as you've said, or in some way they've just put off going to the doctor, and so that by the time they get to the point where they seek care, sometimes it's not treatable anymore, and what was a potentially treatable cancer is now not able to be treated.
And Bruce, what are you seeing now then with people who are coming and perhaps they have delayed? It's at a later stage than it should have been, and the reasons that they didn't come forward sooner.
Yeah, we've seen a big mix of different age groups of people who've turned up with cancers at a stage that you would only see in textbooks. So thyroid cancers that have gone outside the thyroid and invaded the structures in the neck and into the skin. Young people, 13-year-olds with cancers of the salivary glands or cancers of the tongue, things that you would just not normally expect. And this is partly, and in just about every one of these cases, we've been able to look at them and say, well, there's a demonstrable delay there that we think we can put down to a COVID influence. So either the patient hasn't been able to get to their GP, they haven't had the technology to support some type of telehealth, they've used it as a sort of an excuse to put off dealing with it, as your piece said earlier. So, I mean, there are a number of reasons, but it's not just the older men, it's not just people who are putting it off. It's across a lot of age groups, and we've seen it really, diseases that we would see maybe once every 2 years, we're seeing in big lots of cases. So not just a big issue for that one person, but a big issue for the health system to cope with that type of very advanced disease.
And Bruce, part of lockdown, well, a big significant part of lockdown was to save people's lives, to avoid these avoidable deaths by protecting people from COVID. But what you're saying now is, if I'm right, that we're likely to see a spike in things that went undetected during that period, that post-COVID, we may see an increase in what should have been avoidable deaths.
Well, we know in a lot of places that breast screen and screening colonoscopies have had to be put on hold. And COVID has been a great distractor in a lot of ways. It's distracted many other things in the community, but it's also distracted people from this type of standard health screening or going to the GP. They don't want to go to the GP because they don't want to be in a place where they might get COVID. So the distraction of COVID, as important as it's been, has costs in other areas. So it has costs in terms of cancer, cardiovascular disease, dementia, mental health that we all know a lot about. I mean, so we've just got to take that into account, because long after we've finished dealing with the COVID acute problem, which we're not there yet, but when we do, we're going to have this massive backlog of work that it has to be dealt with by a workforce that's been under stress and anxious for 2 years, that is already depleted by people just leaving their workforce, and a system that's stretched because of financial constraints, because so much has had to be spent on COVID. So it's a bit of a perfect storm.
Yeah.